Life as a midwife is not as exciting as you might think. Being a male midwife brings its own set of challenges. Here's a few. Hi all, Mr. Midwife here. These videos do not constitute medical advice. Please seek the advice of your own medical provider. These videos are strictly my opinion and my experiences. Hi all, Mr. Midwife here. I'm doing the topic of life as a male midwife. So I said in my first video that the word midwife comes from Old English. It means with the woman. So I think that anybody who has sat with their mother or sat with her sister or been with their wife is in essence a midwife. If we've attended anybody through any kind of situation, I think we're all at some level midwives, because we've been with the woman during their times of need. Other than that, not a whole lot has changed or is different for me as a male midwife. I think for some of the patients though, they expect to see the midwife. They expect a woman to walk in the room. And when I walk in the room, I think it takes a moment for them to adjust because their expectation is that I'm going to be female. But after the first moment or two, they see that I'm there to genuinely take care of them and see that we have the best outcome possible, and they adjust quickly and go on. As a male midwife, I do deliver in the hospital. You wouldn't see my deliveries being much different than of a physician, with the exception of maybe a couple of things. For example, I see foot pedals and stirrups and things like that as restraints. And so I don't use them during delivery. During my deliveries, I usually have dad on one side supporting one leg and the patient's mom or sister or aunt or somebody on the other side supporting the other leg. And I leave the bed intact and we deliver that way. On rare occasions, if the patient's epidural is so heavy that they can't feel their legs or can't move their legs, they can't feel their face, and I will of course use stirrups if I absolutely need to, but I really try to avoid it because I feel like they are restraints. And then the other thing that I do a little bit differently, or at least I think I do it differently, when a patient comes in to see me in the office and she needs a pelvic exam of some kind, a pap smear, something else like that, I don't use foot pedals in the office. I have her scooter bottom down to the edge of the table and place her feet on the extension part of the table. And then I get myself in position and I pause. And I tell the patient, let me know when you're ready. And then I wait for a moment or two until she gives me the okay to proceed with the exam. I do that because I don't particularly like sneak attacks. I don't want you to be laying on the table and then all of a sudden be pounced upon and have a sneak attack as far as the exam. So I always pause and wait for permission to proceed with whatever it is that I got to do. Other than that, I personally, and this is just me, I personally pretty much follow the medical model of healthcare. You won't see me practicing too far different than what a physician OBGYN would practice. So anyway, that's my life as a midwife, and I hope this has been informative to you. Any other suggestions for videos, thing you want to discuss, leave the comments in the topics, and we'll see you in the chat.